It's a pleasure to speak to you this afternoon at the Future Health Leaders Conference, Inspiring Tomorrow's Leaders. Firstly, let me say that I'm humbled to speak to you today, some of the brightest young minds in health. Moreover, I am inspired by you. You are the ones who will deliver health services to our community into the future. As students and early practitioners, you have worked so hard to get to this point today. You already have an important role in medicine, in nursing, dentistry, pharmacy, community care, and in many other industries caring for the health and well-being of Australians. The Australian Government is doing a number of practical things to harness the energy and ideas of the new and upcoming health workforce. And please, as I speak to you about these programs and incentives, remember to get involved where you can. Your input and ideas about future health services are very important to me as Minister. I'm working hard, as is the Department, to make sure that where there is likely to be a service gap, we can fill the gap. The Government needs to be ready to respond to changes in workforce supply and demand. We know we need to train people up to meet Australia's health needs of the future. And this has to be done in a way that is well coordinated, cohesive, and easy to access. You have worked so hard to get where you are, and we want to make it easier for you, to support you in providing health care for the Australian community. The Government continues to support current scholarships and bonded medical places, including Indigenous scholarships. Next year, we are introducing a new scholarship program from July. This will be more flexible than previous scholarships. We want to encourage people to study health courses in areas with the most need. As part of the Health Workforce Scholarship program, after graduation, most students will give back to local communities, in particular rural and remote communities, through a return of service obligation. Another significant investment in our rural communities is the Rural Health Multidisciplinary Training Program. Despite the Government operating in a tight fiscal climate, we continue to be committed to this program through our ongoing funding of $429.8 million over the next 3 years, and also through expanding the program with funding for a new university rural clinical school. I note that last year, rural clinical schools supported 866 medical students. That's about a third of those graduating, to spend a year of their clinical training in rural communities. This is quite an achievement. The program also supported 5,402 undergraduate and postgraduate students to undertake a rural clinical placement of 2 weeks or longer, equating to a total of 28,321 placement weeks across rural settings. This program is not just about providing quality education and training experiences for students, but it is about the long-term benefits for our rural communities. People having access to dentists is also on our agenda. We want to increase the number of dentists in rural, regional and remote Australia, and the Government is offering grants of up to $120,000 for relocation of dentists and up to $250,000 for dentistry infrastructure. I want to see practices operating more efficiently and to a wider capacity. In order to achieve this, we are helping nurses expand their roles within GP practices. We currently provide up to $125,000 per year to more than 4,000 practices across Australia through the Practice Nurse Incentive Program. As practice nurses expand their roles, the Government remains committed to support and equip GPs to focus on more complex care. For new GPs, we continue to invest more than $235 million to train more than 4,500 GP registrars each year. Ensuring an equitable distribution of the primary care workforce is critical to improving health outcomes across the country. Earlier this year, I announced the introduction of the modified Monash model. This new model of geographic classification will encourage these highly trained doctors to the areas where they're needed most. We are certainly moving in the right direction, but there is more to do, and always ways to improve and to innovate. If you can see an opportunity, I encourage you to send me your thoughts and ideas. Wherever you land in your health career, I encourage you to make the most of opportunities on offer and remain aware of current and future health programs. Remember that you can help shape the future by getting involved in the next generation of policies and programs. We want and need your ideas so that together we can achieve our ultimate objective: better health and well-being for all Australians. Your commitment, your passion and your ideas inspire me as Minister for Rural Health to be a better leader and to build a better health system that you can be proud to be part of. That's my focus, and I know it's yours too. I look forward to working with you in the future. And please enjoy the rest of your conference.